What is a dental cavity? What are the early signs that someone should watch out for? How do we prevent cavity?
Your teeth does not heal all by themselves. Don't ignore the early signs of cavities. Cavities ain't just because of sugar.
Hi everyone, welcome to the Healing Bite, a podcast where we break down complex dental and medical issues into simple and easy to understand conversations. And today we are going to talk about something that everyone has either experienced or is scared of: the dental cavities. And to help us understand what exactly are the cavities, what are the reasons for cavities, and how we can prevent ourselves from getting a cavity, and what are the treatment options available we have. So we have someone in our studio who has been working as a GP dentist in Dubai for the last 5.5 years of her life. She's also worked as a GP dentist in India, and currently she has been serving as a GP dentist in Clover Medical Center. We have Dr. GP.
Thank you, Asim. So that was a lovely introduction.
Alright Doc, let's start from the basics. What is a dental cavity and why do people get them?
Dental caries or dental decay is basically a hole in your teeth which is caused due to bacteria or acids which break down the tooth enamel. Okay, most people think that sugar is the main culprit, but the real reason is that how long the sugar stay in your mouth. When bacteria present in the mouth, they react with sugar, they produce acids which break down the tooth enamel. Eventually, this forms cavity leading to decay. So it's basically not about how much sugar you eat, but how often do you expose your mouth to sugar, and do you properly clean afterwards?
Okay Doc, the next question that I have for you is that many people don't even realize that they have a cavity until it's too late. So what are the early signs that someone should watch out for? And what will happen if someone completely ignores a cavity? Will it go away on its own, or there are some consequences for it also?
Thank you for the question, Asim. It's a great point actually. Cavities, they don't cause pain at first. That is the reason many people tend to ignore them. Early signs of cavities include small white or brown spots on your enamel that is caused due to demineralization. Also, sensitivity is one of the reasons you can have cavity due to hot or cold foodstuffs that is causing sensitivity. And mild or dull pain that comes and goes can also be one of the signs causing cavities. So now, if you ignore a cavity, it won't heal on its own. Rather, it will get more worse. The cavity will penetrate into the deeper layer of enamel, and then dentine, and eventually the pulp, and the nerve gets hit, leading to severe pain, infection, and even teeth loss. So, if you notice any of the signs, don't wait. Rather, get it checked and get it treated. It's more important because it may cause bigger issues later on.
Alright, let's get into the most important part of the video, doctor. How do we prevent cavities? Tell us some daily life habits that can actually make a difference. And to all of those who are watching, if you're finding the video helpful, please make sure to follow us on Facebook and subscribe our YouTube channel also.
Absolutely. Preventing cavities is not that complicated. It's more about consistency. So, there are 3 habits that you should follow in your daily routine. That is, brush twice a day, morning and at night. Make sure you brush for 2 whole minutes. Make sure you're using a fluoridated toothpaste. Fluoride is very important to be in your toothpaste. It's because it helps strengthen your enamel. It helps reverse early decay. So fluoride is very important. Make sure you are flossing daily. Flossing is important because it cleans the food and the bacteria that is stuck interdentally in between the teeth. Other thing is limit the intake of snacking, snacking in between the meals. If you keep snacking, your teeth never gets a break from acid attacks, okay? So make sure you limit the intake and clean your mouth nicely, rinse nicely, drink enough water. All this will help prevent cavities.
Alright, let's say someone already has a cavity. So what are the best treatment options available? I mean, when is a simple filling enough? And when does someone need to go towards a root canal or even extraction?
Great question. So the treatment depends on how deep the cavity is. We can always prevent the formation of cavity by doing a pit and fissure sealant. It is basically a preventive measure. The second thing is doing fluoride treatment every 6 months. Fluoride is really good for your enamel. For small cavities, a dental filling is usually enough to restore the teeth. If the cavity reaches the inner layers of the enamel, dentine, and then penetrating the pulp, causing pain, then a root canal is the only option there. Then if nothing is possible, root canal is also not possible because there is severe destruction of the tooth enamel. In such cases, extraction, that is the last option, though we don't prefer it, but since we have no other option, extraction, removal is the only option then.
Dr. GP has been super informative. Thank you so much, doctor, for your time. Did you ever get a cavity in your life? You can let us know in the comment section. You can also follow and subscribe our channel. See you in the next podcast. That's it for today. Keep a good care of your health and your teeth also.